develop Apofrag as a neuroprotective agent. So let's start with the problem. What is the problem? Basically, the problem is neurodegeneration, which basically is the loss of neuron. It's structural as well as functional properties of the neuron or functional aspect of the neuron. So it will lead to the neurodegenerative disease. So ultimately there are two types of when the neurodegeneration is start, it will progress and lead to the formation of several disease or neurodegenerative disease like Alzheimer's disease, Parkinson disease, stroke, as well as in case of acute injury mediated loss. So the cases and prevalence of neurodegeneration is continuously increasing as the time progresses. So, but there is no as such neuroprotective agent till now which can tackle this problem or which can reduce the increasing prevalence. So what is the need? So there is a need to develop a safe and effective neuroprotective agent. So researchers are continuously trying to tackle this problem or by developing some neuroprotective agent by different kind of aspects. Like one such aspect is what researcher found. They found the native apolipoprotein E, which is a human apolipoprotein E, has a kind of neuroprotection. But what is the problem? So which apolipoprotein is basically a protein which is involved in the lipid metabolism as well as its transportation, and they found it has a neuroprotective role. But the problem with apolipoprotein E is it has a 299 amino acid, which is very difficult to cross the blood-brain barrier. So what they found, and apart from that, researcher also tried to develop like recombinant ApoE and try to complete native apolipoprotein E, and they found there is some other problem as well, like cost problem when we try to develop these kind of formulations or recombinant ApoE, and there is also a variability. So how the researcher tackle this problem? Like 299 amino acid, it's very difficult to cross the blood-brain barrier. So what they did, they basically tried to mimic the native apolipoprotein E with some mimetic peptide. So in apolipoprotein E mimetic peptide, the sequence, the total amino acids are less as compared to the native apolipoprotein E, and that apolipoprotein mimetic peptide mimic the biological functions of native apolipoprotein E. So in that concern, so we also try to develop a apolipoprotein E mimetic peptide, which we term as a Apofrag. So initially, so how we did that? We initially do peptide working. We study complete human apolipoprotein E, and we try to identify what are the those areas which are responsible for the biological activity, or we can say to identify the active region of human apolipoprotein E. So we do peptide working. On the base of the peptide, we selected 11 peptide and identified as well as synthesized, and then we do its characterization in vitro characterization, and we found they have an anti-inflammatory activity using the blood sample and further based on the in vitro data we go for the in vivo studies, the animal model of STZ induced diabetes, and where we found that 2 lead peptide from the 11 total peptides, and from these 2 lead peptide we further designed several novel apolipoprotein E mimetic peptides. So initially the left side panel we can see these are the 11 ApoE peptide, which is the monomeric peptide, or we can say single domain peptide. So based on the results we obtained from this study, we the 2 lead peptide, we just combine 2 lead peptide and develop 7 novel dual domain apolipoprotein E mimetic peptide. So further with those 7 novel apolipoprotein E peptide, we further do in vitro study as well as in same kind of study what we did earlier, and from that we found a single lead candidate, which is Apofrag. So further, initially, like as peptide has an anti-inflammatory activity, so initially to assess whether it has any kind of anti-inflammatory in other kind of disease, like initially we go for the in asthma model, we just check whether it, like asthma is an inflammatory condition. like we check whether our peptide has ability to reduce the inflammation in this model or not. So we found a significant promising result. Our peptide has the ability to reduce the inflammation over there in the asthma model. So we got the idea like peptide having a ability or anti-inflammatory action. Further, as our major aim to develop this peptide is as a neuroprotectant, so we try to investigate its neuroprotective potential in the Drosophila eye model of neurodegeneration, where we found the administration of peptide at a concentration of 6 micromolar significantly provide the neuroprotection. So this work basically done at in a collaboration with the Dr. Amit Singh Lab, University of Dayton, USA. So further, in neurodegeneration several diseases are there, so this is just a kind of confirmation like peptide is having a ability of anti-inflammatory action as well as it has a neuroprotective potential. So from all neurodegenerative disease, so our major focus is on stroke. So as there is no as such neuroprotectant available for stroke, only one therapy which is TPA approved by the FDA, but which is also having a therapeutic window limitation, like if we can give TPA in window of 3.5 to 4 hours, it will be effective, otherwise there will be no effect. So that's why we further did our study to assess its potential in the stroke model. So initially we did its neuroprotective potential in the global stroke model, where we inject the peptide in the mice model of global cerebral ischemia, where we found the administration of peptide significantly provide neuroprotection, and the figure we can see it has a like it also improve the BBB disruption, like it can reduce or the BBB disruption. Further, the inflammatory mediators also reduce over there, so that suggests in global model that it has a shown neuroprotective potential. Further, in different model, like as per the STEER guidelines, we need to confirm the neuroprotection in different models. So further we did it in the focal cerebral ischemia, where we also found significant or promising result similar like the previous studies. So these are the patent, like we have two patent, like one is recently filed patent for the peptide, and these are the publications. So we are currently in TLR 4. If we compare the cost, the current cost of TPA, which is around USD 5,000 to 110,000. If we develop this Apofrag for the treatment of stroke, so it will reduce the cost of treatment by 10 to 15 fold. So the novelty is like it has a novel peptide which is having a dual domain peptide. So if we are firmly believe that if it's successfully, it will be help to neurodegeneration cases tremendously. So this is the work done so far, like we have did peptide working, characterize it, and different animal model of asthma and neurodegeneration Drosophila model, as well as global and focal model of ischemia. So further, what we need to do, right, revalidation or dose optimization in appropriate animal model as per the STEER guideline, like which recommend we need to check neuroprotection in combination therapy like tissue plasminogen activator. Further, we also want to establish like whether it has any kind of effect in traumatic brain injury. Further, we will do safety pharmacology and other studies like tox study and compilation of data and IND filing. So what we expect from the industry, like joint research and technology of transfer program. So thank you.